Hi, it's Danny. Welcome to Danny's Rig. In this episode, we're going to be reviewing the introductory chapters to EMS to help review and familiarize you to the EMS systems. So, what is EMS and what is an EMT? So, the EMS system stands for Emergency Medical Services, and for the most part provides pre-hospital care. So this means any care, aid, any services that you provide before they're in the hospital. So it might be their house, in the street, in a place of business, anywhere outside of the hospital setting. So many people who are not involved in EMS often confuse the terms EMS and EMT. So the difference is EMS is the emergency medical service, while an EMT is an emergency medical technician. So I like to think of it as the S is service and then the T is technician. So an EMT is a person and an EMS is the system. So there are various levels of EMTs within the EMS system. So we are going to be reviewing the different rankings of medical first responders. So an EMR is an emergency medical responder, and these are often police officers or other responders who are the first on scene prior to an EMT's arrival. These people provide very basic care and just keep the patient stable as best they can before the rest of the help arrives. Now, other people who might be on scene prior to the rest of the crew might be an ALS provider, which is an advanced EMT, advanced life support EMT. So they might be an AEMT, which is an advanced EMT, or an EMTCC. But we're going to review that a little bit more later. Right now, we'll just go over the different levels of EMTs. So after an EMR, there's an EMTB, which is an EMT basic. That's what I am, and that's what most of the content on this channel will be covering. And EMTBs make up a large sector of the EMS system. So an EMT basic is what makes up the crew, and they could perform basic life support. So there's different protocols that they follow on what services they could provide. But in other videos, we'll go into more details about what EMTBs can do. An EMTCC or an AEMT or a paramedic are all advanced life support providers. So they could provide extra skills and services that a basic could not provide, which might be inserting IV therapy medication, or there's certain medications in certain states and different skills depending on your protocol that they could do that a basic cannot. However, the way that the system is going, we are expanding the scope of a basic, and there are a lot of skills that basics are going to be checked off competency for, meaning that there's things that normally, traditionally, an ALS provider could do that now we're trying to get basics to do. But for the understanding of this video, just know that there are certain things that an ALS provider could do that a basic would not. So you're going to find while you're practicing that there's certain calls they're going to call a BLS call that just the full BLS crew could handle on their own. Or there might be situations where you would page out and you would want an ALS provider, or an ALS provider would already be on scene to help in certain situations. Unfortunately, there's some scenarios where you would need ALS, but there may not be ALS available, so you would just take care of the patient to the best of your ability using your scope of practice. And your scope of practice is a term to define everything that with your certification that you can do. So as a basic, if I listen to I take someone's blood pressure, that's in my scope of practice. That's something I could do. In my state, I'm able to check a blood glucose level, so that's in scope of practice. But if a basic in most places were to try to intubate a patient, that would be outside of their scope of practice, meaning that they're not certified to do that, they can't do that, that's outside of their scope. So now we are going to be reviewing a basic history of the EMS system. So the EMS system began around World War I and World War II when the military began using vehicles in warfare to treat the injured soldiers on the battlefields. But in civilian life, which is outside of the military, everyday citizen life, it began mostly in treating scenes with basic first aid, and the vehicles were mostly used just to send patients right to the morgue if they were pronounced dead on scene and they were done. But if they needed to go to the hospital, transported, which is the majority of what we do on calls, back in the day, they were taken by family members, relatives. It wasn't performed by the EMTs. In modern day EMS, the way that we know it now was started in mostly 1966 after something called the White Paper Report was published, which that might be a test question. White Paper Report, important document to know about. This document was a response to inadequate treatment of transportation injuries. So now that there are more vehicles on the road, more highways, more accidents, so more injuries, and the way that we were treating them was not adequate enough, and the patients needed more pre-hospital care. It was too late to just care for them once they got to the hospital. It's also important to remember on exams that EMS is a federally administered organization by the Department of Transportation. So if you see a question saying what administers the EMS system, don't pick just like the government or any other department. It's the Department of Transportation, because ultimately our services are in a vehicle. We're driving in the streets. Traditionally, it began because of motor vehicle accidents, which you'll find when you're riding that is a large portion of our calls. So Department of Transportation. The curriculum of EMTs was established in the 1970s after the first EMT textbook was published. This might be the textbook that you're using in your class. It was the one that I used, and a textbook that I use as a resource for this video. It's called Emergency Transport of the Sick and Injured. Mine is an orange book, and it's by AAOS. There might be newer versions now, so that most likely is a book that you're using in your class. Okay. So another important exam question to note regarding an introduction to EMS topic. So if you have your first quiz or homework assignment on Intro to EMS, which is what this video is covering, they might ask you questions about a license versus a certificate. And there's a lot of gray area with that, and there's a lot of confusion between the two. So I'm going to try and explain it to the best of my ability. So a license versus certification. A license is determined on a state-by-state basis. So as an EMT, you need to hold a state license to practice. So it's not like in nursing school, you take the NCLEX, which is a national certification exam, and you can naturally practice as a nurse. There might be differences between states, but ultimately you can practice in any state in the United States. However, with an EMT, you need to have a license in your state to practice. So if you move out of state, you go to college, or you just move somewhere else, then you need to adapt for what that state requires. And there's specific criteria under a license. So you have to be over 18 years of age, and you need to pass a background check, which is true no matter what state you live in. Not that that's a national rule, it's just that every state happens to accept that rule for themselves. Now, a certification is something that someone earns to show basic competency and does not necessarily mean that you can practice with this certification. So for example, many of you probably hold a CPR certification, or you will in order to complete your EMT course. So your CPR certification means that you had the same skill level as the next person who has that CPR certification. So you all learned how to do your compressions, you all learned the steps and procedures for performing CPR the same way, and there's not really, you can't really say someone's better at giving CPR than the next. There's just inadequate, and that's it. So you all do it the exact same way. Now, this CPR certification does not necessarily mean you are a licensed CPR provider. So it's not oh, someone falls on the ground, we need someone specifically who's licensed to do it. It doesn't really work like that. Because the Good Samaritan law, anyone could attempt to do CPR on someone who falls on the ground to try and revive them. However, if you had that certification, that's just a little card that shows that you are competent with the skills and you know how to adequately provide the resuscitation. Okay, so that covers a brief summary of the content regarding introductory to EMS. I hope that this was helpful, and best of luck on your exams. Oh, and if you have any requests for future topics to review, feel free to leave them in the comments. Have a great day. Bye.